Okay. Hello, I Dr. Hemali welcome you all for the third session of our PH Pro program. For today's session, we are having our proud alumni from 2015 batch, Dr. Simran Torani. She has done her Bachelor of Physiotherapy from Ashok and Rita Patel Institute of Physiotherapy, CHARUSAT University. She has completed MSc in Advanced Physiotherapy from University of Salford in Manchester. She is right now working as an HCPC registered physiotherapist in Stockford NHS Foundation Trust, UK. So I welcome you, ma'am, for today's session. And session is over to you.
Thank you very much, Himali madam. First of all, I would like to thank CHARUSAT University for giving me this opportunity to share my experience working as a physio and giving me an opportunity to guide the physio aspirants. I'll try my best to provide as much information as I can in this session. I would like to ask among the students, what language would you be preferring? Are you all happy with English, or do you want me to speak in Gujarati or Hindi? Is there any preference? You can write your answers in chat. Okay, I have got an answer as English, so I'll go with that. I'll just share my screen.
Ma'am, you are having access to it.
Sorry?
You can share the screen.
Yeah, okay. Are you able to see my screen now?
Yes.
Yes, okay. Okay. So I haven't made an advanced presentation because I would like to give you just brief information about how it is over here working as a physio in UK. So starting with, what are the regulatory bodies in UK? So for practicing as a physiotherapist, there are three major bodies. First is Health and Care Professional Council. For this, you need to get yourselves registered. There is no license examination. This is very different from all the other countries. And this was one of the things which attracted me over here as well, because you don't have to give any exams for license. There is only paperwork. There is a detailed form that you need to fill. You need to provide the documents from your university back in India, and that's it. And then they will help you register there. The only criteria over your major is that you need an IELTS examination to prove that your English is competent, because there are no exams. So this is their rule. And in English exam, you need to have bands 6.5 minimum and 7 all over. So that's the criteria for getting registration in HCPC. Other than that is a Chartered Society of Physiotherapy. So this society is also a regulatory body. It is not necessary to register with this body, but it is important as here it is very different system than India. Just like we have in IAP, GSCPT in India, these are regulatory bodies over here, but main registration is through HCPC. CSP is a sub body which regulates rights of physio, pay scale of physio and all, because here there is common pay scale all over UK. It isn't like you can charge as much as you can. Yes, as a private physio you can, but when you go for job in hospitals, it is same pay scale all over UK. I'll come to that when I
Hello, ma'am.
Yeah, sorry, go on.
Can you on the video?
Oh, yes, I can. Give me 1 second.
Thank you.
Are you able to see me now?
No.
No? I have turned it on, but I don't know why I'm not able to share it. I'm sorry.
What setting you can see?
Mm. Yeah, it is on. I'm turning it on, but it's not working. I'm sorry.
No problem. You can continue.
Sorry about that.
Okay, no problem.
Yeah, sorry, go on. Sorry, yes, I was saying that about CSP. So it regulates the pay scale over here. So like recently, physios had a strike because the pay rate was less. So CSP was the one who was looking into the matter and fighting for the rights of physio. Apart from that, because there is a lot of insurance claim over here through patients if anything wrong happens. So basically, CSP helps us to protect us in all those situations. Third regulatory body is BASRAT, which is British Association of Sports Rehabilitators. This is completely for the physios who are only interested in sports injuries and sports rehabilitation. So they work alongside the field. They work alongside the field where all the matches happen. They can be working on field, they can be working off field. So this is one of the body. If you are interested in working as a sports physio, then you can get yourselves registered with this body. After registration, you can work as a private as well as a government, in a government hospital, which is NHS, which is National Health Service over here. And the recruitment, and it is a band system over here. Like for example, a therapy assistant, you can start as a therapy assistant, which is a band 4 scale. You can progress to band 5 as a fresher physiotherapist. Like for example, if you are qualified newly, then you can start as a physiotherapist, which is new graduate, which comes under band 5, and then you can progress up till band 9. So it isn't like you can progress in the same hospital. Like for example, if you have worked in the same hospital for example 6 months, and the manager feels that you are doing well, so they promote you to band 6. No, it doesn't happen like that over here. You need to apply for that particular band after you feel that you have enough experience as in that band, working as band 5 qualified physio, and now you want to jump up. So then you have to apply for band 6. Even though you are applying in the same hospital, doesn't matter, because there isn't anything like promoting you to a higher band in within service itself. You can apply in the same service, but you have to apply. There isn't like any direct promotion. And the pay scale, I was saying before that it is same all over UK. So you start as a band 4 physiotherapist, where it starts with a package of £23,000 annually, and it can go up to £27,000. After that, band 5 starts from the pay scale of around £28,000 up till £34,000. So you can get an appraisal every year in that, but you cannot be promoted in the bands system like band 5, band 6. And band 5, in band 5 role, you can work as a rotational physiotherapist. So what is a rotational physiotherapist? So in that, you get rotations in each and every aspect. Like the rotations can vary from 6 months to 9 months, and it can be in any field, like neurology physiotherapist, musculoskeletal physiotherapists, like what they call trauma and orthopedics, community. Then it is a pediatrics, cardiovascular, respiratory. So you just keep rotating among different services in that setup. And generally rotations last for 6 months to 9 months. And yeah, that's how rotational physiotherapists work. Generally, when you start a physio career over here, like as a band 5, then you start as a rotational physiotherapist. So it is believed here that when you start as a rotational physio, you can work around all the services, and then you can have an idea in which field you want to progress further. So for example, if you have worked for 2 years in all the setup, then you can know which is the one with you want to proceed further. Apart from that, you can directly work as a community physiotherapist, in which you have to work alongside social workers and occupational therapists. And so basically you have what you are doing is trying to help people get back into hospital from home. Back into home from hospital, and then going into their home and visiting them. But that all comes under National Health Services. So that is a completely government body still. Even if you're going in their homes for doing some physio or some walking practice or rehabilitation thing, it still comes under government. The difference between a community physiotherapist and rotational physiotherapist is that in rotation physio, as a rotation physio, you will be working in acute setup in hospital, but as a community physio, you will be working in community, like in and around people's houses and people's environment. So basically going to patient's house, getting them independent in their own setup so that they no longer need help of anyone for doing their basic activities, like maybe washing themselves, dressing themselves, and all sorts. Going back to where else you can work. You can work in private practice, like clinics, which we have in India as well, physio clinics. And in that, they generally work as a mask physiotherapist. There are very less clinics over here, particularly for neurological or pediatrics. Mostly the clinic setup over here is for skeletal patients. And in that, you can start your journey as an MSK physiotherapist. There is no bending in that. There is no bend system in that. So you get paid according to your experience. And when you go for private, as a private physio in private setup, then your experience from India does count. Whereas when you work in government setting, because the system here is very different, they don't generally give you directly band 5 job. I'm not saying that you cannot, but it's just their preference that you have some basic NHS experience before you start as a completely independent physio. So this is from my experience, because I tried applying to many band 5 experience, but because you have not worked in that setup, you don't understand what are the trust values of working in NHS. You do not understand how the system works. So it is always ideal that you start as a therapy assistant working as a band 4, when you learn how everything happens, and then you can straight away apply for band 5. So I too worked as a therapy assistant for approximately 5 months, and then they were happy with my work, and so they helped me to apply for a band 5 and got my recruitment done. So it is very different over here from India. When in India, you can discharge the patients directly at home after admission. There isn't any system like discharge to assess, or you need to take into consideration like how is the patient going to manage at home and all sorts. Whereas over here, you need to take everything into consideration while you are saying that patient is fit to go home or you're happy to discharge. So all those things needs to be considered, and that comes under community physiotherapist. Like right now, I am working as a community physiotherapist in discharge to assess ward. So how do I work? So it is like the patients who are medically fit comes under our service, but they are not ready to go home. Do you understand the difference between the two? Like, for example, they are medically fit, but they are not still mobile enough to walk by themselves in their setup at home. So we assess them. What needs will they have at home? Will they need any support from the carers? So, or is there anyone at home who can help them with their basic needs, or what else service will they require? So we need, as even though I am a physio, I need to look into everything. What all will the patient need at home after returning? We work alongside occupational therapists. So mostly it is like our role do cover like overlap with OTs. So because they help us doing access visits and environmental visits. Like, for example, going into patients' home before discharging them and looking into things like sofa height. Will the patient be able to stand up from that sofa height? Will the patient be able to use that toilet? Is that toilet height enough? Will they require any other equipments? So basically looking into their environment to see what can we add to facilitate it, like putting grab rails, like handles on the doors so that they can use it to get into the house. Basically all sorts of equipments that can help them ease their activities of daily living. Because we are working in a team, sometimes due to the short staffing or service demand, a physio will have to do an environmental visit, but you can get training in that. Like when you start the role and you can work alongside OT, you can go with them out into the patient's house and you can get training in that. When you will be doing your bachelor's in India as a physio, at that time as well, you will have a subject called community physiotherapy, and in it will be everything that I'm talking about now: heights, disabled toilet, grab rails, stairs, everything will be but when in India setup, we don't use that much. When you come to UK, or I'm assuming in any other countries, it is very different. So you take that everything into consideration. So that is how it is over here in NHS. But like, as I was saying, in private, you work as an MSK physiotherapist. So you are allocated like in a clinic. It is not like India that you give physiotherapy treatment for 3 hours, 2 hours, just to help patients get better results. You have got the time scale of half an hour. You need to assess the patient in their initial assessment and decide what treatment will they require in the first session, and post follow-up will be only treatment sessions for half an hour. That's it. But in half an hour, you need to make sure that you do all the manual things that are supposed to be done, and then help prescribe them some home exercises. So like printing the exercises in paper and helping them so that they can follow up at home. So generally over here in clinics, you hardly do any active exercises. It's all manual that you do, and patients do their exercises at home. So how do you progress as a clinical physiotherapist in a private setup? So you can work as an FCP, which is a first contact practitioner. This is a new role over here. It just came around COVID setup. FCP can work in private as well as government. So Generally, it is in private, but then now it is there in government setup as well. What is a first contact practitioner and how it is different? So it is like you work as a doctor. How? So any patient who is referred as having a pain, they are referred to FCP. So as a physio, you do the diagnosis and refer it to any further services needed. For example, there is a patient who comes to you with knee pain. Then you do your assessments, you do all the tests that you feel needs doing, like a differential diagnosis test. And then if you still feel that, I think radiology is still required, so then you refer that patient to radiology department. Or if you feel that this patient needs medicines for easing the pain, so then you refer that patient to a general practitioner, which is a normal doctor. So you do the diagnosis and you refer the patients to different services which are available. And you are completely independent with all the findings and all the diagnosis. You have to do everything by yourselves. You can be guided by doctors sometimes, but for example, you call a practice over here, like a medical practice, and say that I have so and so pain. So they refer you to FCP. It is not necessary that you always get patients which have musculoskeletal pain. It can be any other pain as well. So it is important that you do the diagnosis correctly and just not consider that it is a musculoskeletal pain and continue with the physiotherapy. So it is a bit of challenging job, but once you start getting experience and you can be an independent first contact practitioner. So when you work in a clinical setup over here in India, they do train you to promote to a FCP. And after that is advanced care practitioner. So it is same like FCP, but more advanced. You can like there are various levels that you need to cover in increasing your in increasing your role, like for example, from turning to FCP to ACP. So basically FCP, I would say, would be a band 7 in scaling, and then band 8 would be ACP, which is an advanced care practitioner. And also you can give corticosteroid injections to patients as an FCP or ACP. There are some certifications that you need to do, but you can work as an independent so-called doctor over here and in FCP and ACP. And if you feel that, no, after I have done my bachelor's in physio, I still need something more, then what more? So you can work as a sports rehabilitator, just on field and working alongside sports person. There are different courses over here that you can take, like exercise science and exercise physiology, sports rehabilitation. For your masters, you can get yourselves registered through that British Association for Sports Rehabilitators, and then you can work as a sports rehabilitator, which is a complete different field over here from a physio. Or you can work as an occupational therapist. As I was mentioning before, generally occupational therapist role and physiotherapist role overlaps. So you can work as an OT. What other things you can do as an OT is like you can do kitchen assessments. For example, helping assessing patients in their kitchen environment, helping them see, can they make their own tea? Can they make their own breakfast in the morning, like just toast and boiling eggs and all sorts of things. So they call it as a kitchen assessment. Then as I mentioned, as an environmental visits, they do environmental visits. And Also, you can give recommendations in terms of working environments, like ergonomic needs, if there are any, and if there is any occupational health which is causing you trouble. For example, you're working long hours on computers and then you have some kind of musculoskeletal pain develop because of it. Then, as an occupational therapist, you can also work as an occupational health provider, which looks into consideration what modifications we can do to ease that pain and help you at your work. And as a chiropractor, chiropractor is like the one who do manipulations over different joints of the body. So, but I think as a chiropractor, it is mostly a clinical setup that you work in, and there isn't any particular role in NHS. I won't say there is not any, but it is less scope as in government setup. But as a physio, there is tremendous scope working here in government as well as private setup. They are always in need of physio. They're always in need of occupational therapists. In fact, more for occupational therapists than physio. So if you're thinking that I have done my bachelor's in physio, I know a bit of physio, I wish to know a bit of more of an OT, you can join a course over here, which is MSc in occupational therapy. And yeah, you can become an occupational therapist. I think that's it from my side. But if there are more questions, I'm happy to answer all the questions.
Session is for the question answers. You can ask.
Yeah, okay, I can explain about the regulatory bodies once again. So basically, sorry, Trisha, can you also say just about working as a physio or about sports rehabilitators? Which particularly you want to know? Working about physiotherapy. Yeah, okay. So suppose you do your bachelor's in India and then you come over here with some master's program, then you can do your master's program here, and simultaneously you can start your process of getting your license. And there is a form online that you need to fill. It has all sorts of questions like, what subjects did you study in India? If you have any work experience, then what were your roles and responsibilities working there? So you need to provide in detail information about, I have worked in musculoskeletal setup where I have seen so and so kind of patients. I used to do my diagnosis through using differential diagnosis tests, giving different treatments, what sort of treatments, electrotherapy department. You can say I have worked in, because you will be doing an internship, which will be a rotational. So you can write down that you have worked in neurological setup where you have seen stroke patients, seen Parkinson's patients, MS patients. You have worked in pediatrics, seen all different patients of cerebral palsy, Down syndrome, basically explaining in detail whatever you have done in India as a student physio or after your studies. And then once you have done it, alongside that, you need to submit your IELTS score, which needs to be 7 and no less than 6.5. and submit your application. That's it. There is nothing complex in it. You don't have to give any exam. You just have to fill one form. Yes, there are a few documents that you will require from your university that needs to be signed and stamped. But I am pretty sure that university does help a lot. Like for me, it happened straight away. I just emailed Vidhi ma'am and Bala sir, and they were up to it. They did it very quickly. So yes, universities do it, and then there isn't anything. Okay, what about sports rehabilitation? So yes, it is the same process in that as well. There is no examination. There is form, you can get yourself registered. Yeah, same way. It isn't much different in both. So part-time job for international students. You can work for 20 hours in a week. You can, while you are a student, you can work as a therapy assistant for 20 hours, or you can do some shadowing. So what is shadowing is you voluntarily go, or sometimes you'll have to pay, but it just depends on your contacts. You can go to a private clinic. You can just do an observation thing, how they work, how is the setup, what things are they taking into consideration. So yeah, you can do that, because over here they also count that you have done some shadowing. You can get a certificate from the person or from the clinic where you have done it as a student, or you can do some side jobs to get some earning. It's just completely up to you what you want to do. Have to enroll ourselves in FCP after bachelor's. So Shruti, in that there is nothing like you need to enroll for an FCP. You need to have some kind of experience before working as an FCP, like a good amount of experience. For example, maybe 4 to 5 years or something like more. But once you start your practice over here, for example, like me, I am a freshly graduate from India. I straight away came here by only working I only worked as a 1 year MSK physio in India. And then I came here. I did my MSc, and then I straight away started. So I do not have that much amount of experience that I can directly work as an FCP. But after a certain amount of experience, I can get myself trained in FCP. And yeah, so there is nothing like enrollment. It's like a step-up process in your career that you can have after a basic physio. After doing masters from outside, we have to give some exam in India, or we have to do direct practice? Yes, so you just need registration with this council, HCPC, and you can straight away work. You can apply in HCPC when you are still in India. So you can directly get your HCPC registration. The only trouble you have is, even though you can get your registration in HCPC, you might not be able to get job directly, because generally they would prefer someone who is already on shores instead of hiring someone who is off shores from India. So job thing is a bit tricky if you're applying from India directly, but you can get your registration sitting in India as well. According to you, which one is best to do? Sorry, Princey, do you mean in terms of physio, OT? Or do you mean in terms of working as a physio with setup is good?
Hello, Princey.
Working purpose. Yeah, okay. So I think that is the same question for Trisha as well. From my personal opinion, working in a government hospital is always beneficial, because you are protected by, like, you have a security for visas as well, because you're working in a government setup. They provide you visa straightforward for work visa for 5 years, and then you can apply for your British passport after 5 years. I know the immigration rules are changing right now, but like up till now, it has been that you need to work for 5 years in work visa, and only then you can apply for a British passport. So government hospitals, it's easy to get your visa sorted and all sorts of things. So you get, apart from that, you get lots of benefits as well working in NHS. You get NHS discounts in shops, in all basically all shops over here. You get NHS discount, staff discount. So then you get NHS pension scheme. So there are more benefits working in a government hospital than as in a private clinic. I would say work in NHS from my perspective, which is good to opt rotational or community. Trisha, it completely depends on you. So you can start as a rotational, do all the rotations, and you can do your specialization in one. So yeah, I will also elaborate on that in India, we have MPT in neuro, MPT in sports, MPT in musculo, but it isn't like that. It isn't like it over here. You can do your basic MSc, which is a generic, which I did, MSc in advanced physiotherapy. And if you feel that you want to particularly work in pediatrics or neurology, there are courses like 3-month course that you can do. And sometimes you get certifications as a PG diploma or PG certified. So yeah, after that, you can work especially in that field, like just a pediatric physiotherapist. But you can do these courses in between to get that specialization. But there, I was searching for, because I was very much interested in pediatrics and neurology, but I was not getting any particular and even if I was getting, then the fees was very high for someone coming from India. So I just did my generic masters, and now I can do some certification courses and start as a pediatric physio. But it is completely upon you, Trisha. You can work as a rotational and then decide which field suits you. Why did you choose UK for masters and not USA or Canada? So, in Canada, because I wanted to do masters, in Canada, you don't get masters. You have to do post-graduation diploma, which I was not very much keen on doing it. For USA, I was not able to afford the fees that they were having. UK was in between that. You have only 1 year of masters. You get a master's degree in 1 year, and you get 2 years of work visa. And in finance term as well, it is, my fees was around 15 lakhs, and I got 4 lakhs of scholarship. So it was around 11 lakhs. So it was in my budget. So basically, you need to consider everything. If you want to do masters, okay, which country provide masters? You need to consider what are the finances. If you are okay with finances, then you can opt for USA or Australia, and you can start your process there. But if you feel that no, this is very high, because in Australia as well, I did apply for Australia, but then the fees was also very high in Australia. It was around approximately 40 lakhs for 2 years, which is very high for someone coming from a middle class background in India. So yeah, considering all that, I thought UK was the best option for me. And I am, like, from my experience, I would not regret taking that. I know it is difficult over here to get a citizenship and all, but once, because you are in a healthcare field, it is never, it is difficult, but you will get through it. Working purpose, yeah. And yeah, go on.
There is one question from student, that is it possible to go abroad in 5.5 bands in UK?
If you want to do masters, then just in physio, then it is difficult. But for, as I explained, for HCPC registration, for you need 6.5, and above that, all over 7, no less than 6.5. So you might come here, but then you won't be able to get yourself registered as a physio. How can we get recruited in NHS? Does it require to exam for higher band? No. So sorry, Nihar, for working in NHS, there are different websites. Like particularly, there is only one website for NHS, but then you can apply through Indeed, LinkedIn, and there are agencies over here, but then that is locum. For a permanent staff, you need to apply through a NHS jobs website. It also has in detail form that you need to fill. Why do you think you are suitable for this role? What are your qualifications? And what all registrations do you have over here? So yeah, it is only NHS jobs website through which you can apply to work in NHS. Apart from that, Indeed, LinkedIn, and some agencies. But if you get recruited to agencies, it is just a temporary contract for 6 months, 4 months. It isn't a permanent thing. What are the scholarship opportunities in UK? So it is varying from each university, but you do get scholarships. Like I was saying, I got scholarship for 4 lakhs based on my scores, based on my bachelor scores, because through IELTS there is a criteria that you need to have so and so bands in IELTS. So you won't qualify for a scholarship based on your IELTS score, but based on your bachelor score. So there are scholarship opportunities in UK which each university do provide. UK will be better or Canada? Again, Tara, completely depend on you. If you want to get quick PR, then I would say Canada. But if you want to do masters, no exam, just 1 year masters, then UK is also good. Rotational includes all fields. Yes, rotational includes all fields, Trisha. Every setup it will include community, neuro, ortho and trauma and orthopedics, pediatrics, cardio, respi, everything. Which university you're I did my MSc from University of Salford, which is in Manchester.
Any other questions?
Average month expenses in UK. The cost of living is going up now. So I would say around, if you are living in sharing with other people, then maybe 600 to 700 pounds per month, just if you are living with someone, sharing your room and everything.
Yes, Priyanshi.
Occupational therapy is best for sports therapy.
Which is better, do you mean occupational or sports?
Yes.
It is based on your interest. If you are happy seeing sports persons, like working on fields, working alongside them to train them, and yeah, then sports physiotherapy is also very good over here. And if you want to work in a clinical setup, then I would say occupational therapist. So it depends on which setup you want to work, basically. If you want to work alongside sports person on field or after field, or join them in their practice sessions and all sorts, then yeah, go for sports physiotherapist. Scope for any healthcare provider is very good in UK. You may consider occupational therapist, sports physiotherapist, a normal physiotherapist like me, or any other field in healthcare. It is very good.
Okay, ma'am. Thank you.
One question is there, is New Zealand applicable for physiotherapy?
New Zealand is, yeah, like, I mean, how is New Zealand? Yeah, you can apply for working as a physio in New Zealand. Like, on this note, I would like to add that if you get once your HCPC registration, you can get registration for Australia and New Zealand. You don't have to give any exams over there. You can straight away pass your license from UK. There is a form, again, which you need to fill in detail. But once you are registered in UK, you can get Australians license clear and as well as New Zealand's license clear. And you can get the as well over there. Are there any exams for physiotherapy in Canada? Yeah, I think for working as a physio in Canada, there is a license exam that you need to clear. And it has both written exam as well as a practical exam. So like you completed the rotational physiotherapy. So what's the procedure after that? So Trisha, if you are working as a rotational physiotherapy, if you feel that I have got some experience which I need, you can straight away apply for a higher band, which is a band 6. It will also have a rotational band 6 physio. Your pay scale will improve. So pay scale for band 6 is from £25,000 onwards. So yeah, and then you would be managing teams, and yeah, it's like once you feel you are competent enough, even after working for 6 months, and if you feel you are ready to go for higher band, you can straight away apply for higher band. There isn't any time scale that, oh, I need to do my rotations, all rotations. You can even in between switch to higher band if you feel that you have got enough experience in 2 rotations, maybe. Like I have only worked as a band 6 physio for 7 months now, but now I'm feeling that I am confident enough to go for band 6. I'll straight away apply. There is no time scale for working as a rotational physio. Which country is better for physiotherapist, India or Australia? Again, it is just upon each and everyone's wish. Like if you want, you can work as a physiotherapist in India. You can have your own clinical setup, or you can work alongside hospitals, do your master's, become an associate professor in future. And yeah, and then if you want to earn more or have a better lifestyle, or are ready to do all sorts of struggle after coming to foreign country, then yeah, opt for foreign country. But it is a hassle. It isn't an easy thing. You will have all sorts of troubles when you first come overseas, like the weather, sharing homes with different people. Might be you won't have community over your own religious community. So yeah, you need to be prepared for everything if you come overseas. Ma'am, I want to do masters in occupational therapy in field of neuroscience and orthopedics too. So can I do the same university without an exam after completing masters in one field? So Udit, if you want to do masters in occupational therapy, I think there isn't any specialization like that in neuroscience or orthopedics. So like after doing your MSc in occupational therapy, you can again work as an rotational or OT, and you can get experience. But up till what I know, I don't think there is any specialization in orthopedics or occupational therapy or something like that. What specializations are offered by UK University for masters in physio? So yeah, what specializations? So basically there are 2 courses over here, which is MSc in advanced physio, which I did, and another one is MSc in physiotherapy, which is a pre-registration course, and it is for 2 years. But if you have done your bachelor's from India in physiotherapy, then you cannot take cannot apply for 2 years of MSc in physio program. So that is for someone like who have done occupational therapy in India, but now want to switch to OT. So they have to do this 2 years of program in MSc physio. But for us who are already done bachelor's in physio, it is only 1 year program, which is MSc in advanced physio. Apart from that, you can do courses like exercise science, exercise psychology, exercise physiology. Yeah, you can do courses like that. Any more questions?
Any questions?
You say rotational include all fields. Is it like that you have to choose one field? We are good, or say got interest in that, or can continue in all fields? Yeah, you can continue all fields. So like I was saying, there are opportunities as a band 6 rotational physio as well. So you continue doing your rotations and keep increasing in band scale, or you can select one field and work in that field. So there are both options available. What master course beneficial to do in UK? I would say do which I did, MSc in advanced physio, because it has all, and you will have a gist of what it is like in UK. They do programs. They have subjects like research, basically, that you need to do in every master's over here. It is very important. That is the main subject that you need to do. You have rehabilitation strategies. You have subject called neuromusculofunctional diagnosis. So in that, they teach you everything about diagnosis. And then you have a subject called manual therapy, in which you do all the manipulations and all the exercises. So I would say opt for the program which I did, MSc in advanced physiotherapy. It is a generic program. It is not a particular master's in one field, but yeah, you have idea of everything, how it is in UK.
Any more? Then should we end?
Yeah, if everyone is happy, then.
Yeah, thank you, ma'am, for giving this informative and insightful session and making the students know what are the scope regarding physio as in UK.
No
Thank you,
worries.
ma'am.
Very much. Thank you very much, Himali ma'am and Bala sir, for giving me this opportunity.
Thank you. Thank you, everyone.